Irritable bowel syndrome, often called IBS, is a very common disorder. It affects the large intestine, also known as the colon. Many people around the world experience IBS at some point in their lives. It is important to understand that IBS is a functional disorder. This means the bowel doesn't work as it should. However, unlike other bowel diseases, IBS does not cause visible damage or inflammation to the bowel tissue. Doctors can diagnose it based on symptoms after ruling out other conditions. It is a condition that can cause significant discomfort and distress for those who live with it daily. What exactly is IBS? It is a chronic condition characterized by a group of intestinal symptoms. These symptoms often occur together. The exact cause of IBS is not fully known. However, several factors seem to play a role. These can include problems with how the gut muscles contract. It might involve increased sensitivity to pain in the gut. Some people develop IBS after a severe gut infection. Stress and changes in gut microbes, the tiny organisms living in our intestines, may also contribute. It is a complex interaction of factors affecting gut function and how the brain and gut communicate. Living with IBS can significantly impact a person's daily life and overall well-being. The unpredictable nature of symptoms like pain or urgent bowel movements can be very challenging. People might avoid social situations due to fear of symptoms. Work or school attendance and performance can also suffer. The constant worry about symptoms can lead to anxiety and a reduced quality of life. Finding ways to manage IBS is therefore crucial for maintaining daily routines and emotional health. Many people find they must plan their days carefully around their condition, which can be quite limiting. The experience of IBS varies greatly from one person to another. Some individuals may have mild symptoms that are only occasional annoyances. For others, the symptoms can be severe and persistent, truly disrupting their lives. The type of symptoms can also differ. Some mainly experience diarrhea, others constipation, and some alternate between the two. This variability makes a one-size-fits-all treatment approach difficult. Understanding your own specific pattern of symptoms is a key first step. This personal understanding helps in finding the most effective ways to manage the condition and reduce its impact on your daily activities. One of the most common and definitive symptoms of irritable bowel syndrome is abdominal pain or cramping. This discomfort is often located in the lower abdomen. The intensity of the pain can vary widely. It might be a dull ache for some individuals. For others, it can be sharp and quite severe. Typically, this pain is related to bowel movements. Many people find that having a bowel movement provides some relief from the pain or cramping. The pain can also be triggered or worsened by eating certain foods or by experiencing periods of increased stress, making daily life unpredictable. Changes in bowel habits are another hallmark sign of IBS. These changes can manifest in several ways. Some people primarily experience diarrhea, known as IBS-D. This involves frequent, loose, watery stools and an urgent need to go to the bathroom. Others struggle mainly with constipation, called IBS-C. This means having infrequent bowel movements, difficulty passing stools, or feeling like the bowel is not completely empty. A significant number of people experience alternating periods of both diarrhea and constipation. This is often referred to as IBS-M for mixed type, adding another layer of complexity to managing the condition. Beyond pain and altered bowel habits, other symptoms frequently accompany IBS. Bloating, which is a sensation of fullness or swelling in the abdomen, is very common. Excessive gas or flatulence can also be a persistent and sometimes embarrassing issue for many individuals. Some people may notice mucus in their stool. This is not usually a sign of a serious underlying problem in the context of IBS, but should be mentioned to a doctor. Feeling tired or experiencing fatigue is also reported by many individuals living with IBS, likely due to the chronic discomfort and stress. It is very important to remember that the specific symptoms and their severity can differ greatly among people with IBS. What one person experiences might be quite different from another's experience. Symptoms can also change over time for the same individual. One month might be dominated by constipation, while another might bring more issues with diarrhea or bloating. This variability is a key characteristic of IBS. Therefore, keeping a symptom diary can be very helpful. This can help you and your doctor identify patterns, triggers, and effective management strategies tailored to your unique situation. If you suspect you have IBS, getting a proper diagnosis from a healthcare professional is the first essential step. Your doctor will likely review your medical history and symptoms. They may also perform a physical examination. In some cases, further tests might be needed to rule out other conditions with similar symptoms. These could include celiac disease or inflammatory bowel disease. A correct diagnosis is crucial because it ensures you receive the appropriate guidance and treatment. It also provides peace of mind by excluding more serious conditions. This clarity allows for a focused approach to managing your specific symptoms effectively. Once IBS is diagnosed, your doctor might discuss medical treatment options. These are generally aimed at relieving specific symptoms. For example, if constipation is a major issue, laxatives or medications that help soften stool might be prescribed. For diarrhea, anti-diarrheal medications can be helpful. Antispasmodic drugs can reduce abdominal pain and cramping by relaxing the gut muscles. In some cases, low-dose antidepressants are used, not primarily for depression, but because they can help modulate pain signals from the gut. It is important to discuss potential side effects and benefits of any medication with your doctor carefully. Lifestyle changes are fundamental to managing IBS effectively for the long term. Diet plays a very significant role. Many people find relief by identifying and avoiding trigger foods. Common culprits include fatty foods, caffeine, alcohol, and artificial sweeteners. Some find a low FODMAP diet particularly helpful. FODMAPs are types of carbohydrates that can be poorly absorbed and ferment in the gut, causing symptoms. Working with a dietitian can help you navigate dietary changes safely and effectively. Stress management is also key, as stress can significantly worsen IBS symptoms. Techniques like mindfulness, meditation, or deep breathing exercises can be beneficial. Beyond specific dietary changes and stress reduction techniques, other general lifestyle adjustments can support gut health. Regular physical exercise is often recommended. Gentle activities like walking or swimming can help regulate bowel function and reduce stress. Aim for consistency rather than intense workouts, especially if you are new to exercise. Ensuring you get adequate sleep is also important for overall well-being, including digestive health. Dehydration can worsen constipation, so drinking enough water throughout the day is a simple yet effective measure. These holistic approaches can greatly improve your ability to manage IBS symptoms and enhance your quality of life. Several simple home remedies can offer comfort and help manage IBS symptoms. Peppermint oil, often taken in enteric-coated capsules, is known for its ability to relax the smooth muscles of the gut. This can help alleviate abdominal pain and cramping. Probiotics, which are beneficial bacteria, may help restore a healthy balance of gut flora. You can find them in fermented foods like yogurt and kefir or as supplements. However, the effects of probiotics can vary, so it might take some experimentation to find one that works for you. Drinking herbal teas like chamomile or ginger tea can also soothe the digestive system for some individuals. Ayurveda, the traditional Indian system of medicine, offers a holistic perspective on digestive health. In Ayurveda, good digestion is central to overall well-being and is governed by Agni, or digestive fire. IBS symptoms might be seen as an imbalance in Agni, leading to the formation of ama or toxins. Ayurvedic approaches often involve dietary modifications tailored to your individual constitution, dosha. This might include eating warm, cooked foods, avoiding incompatible food combinations, and using specific herbs and spices like ginger, cumin, and fennel to support digestion. Practices like drinking warm water can also be beneficial for stimulating digestion. Gentle yoga exercises can be particularly helpful for individuals with IBS. Yoga combines physical postures, breathing techniques, and meditation. This can help reduce stress, which is a known trigger for IBS symptoms. Specific poses can also gently massage the abdominal organs, potentially aiding digestion and relieving bloating or constipation. Poses like cat-cow, Majrayasana to Bitilasana, can improve spinal flexibility and gently stimulate the abdomen. Wind-relieving pose, Pawan Muktasana, is specifically aimed at releasing gas. Child's pose, Balasana, is a resting posture that can calm the nervous system and gently stretch the lower back, promoting relaxation. Always listen to your body. It is important to approach the management of IBS with patience and a hopeful outlook. While IBS can be a persistent condition, it is manageable. By understanding your symptoms, working with healthcare providers, and exploring various strategies, including lifestyle changes, dietary adjustments, home remedies, and practices like Ayurveda and yoga, you can find significant relief. Many people successfully learn to control their symptoms and lead full, active lives. Remember, finding the right combination of approaches may take time and experimentation. Be kind to yourself during this process and celebrate small victories along the way to improved well-being.